Hello, I'm Kim Durand with the Arlington Partnership for Children, Youth, and Families, and today we're going to take a minute just to look at the 2019 Community Report. And I am joined.
My name is Rebecca Hjelm. I am the data specialist with the Arlington Partnership for Children, Youth, and Families.
So we're going to spend just a minute first talking a little bit about what the partnership is, in case you're not aware. We are a community-led organization. We started about 20 years ago, and we have 16 appointed community members, and we also are joined by high-level county and school staff, and so it's really wonderful because we're all in the room at the same time to learn about the issues and think about strategies to support children, youth, and families in the county. So we're excited that we've got folks like the Department of Libraries, Public Health, Police, Juvenile Justice, Parks and Recreation, and Child and Family Services. But in the schools, we're also joined by Student Services, Administrative Services, and the Family and Community Engagement staff. So when we're all together, it's a great group of people to think about the supports that our community needs. So our three words are research, engage, and advocate. And so the research really is this report. This report culminates with data from the Your Voice Matters survey, from the Youth Risk Behavior survey that we do at middle and high school, and then also looking at some data from around the county. So we work with some of our partners like APCYF to talk about food needs, and we work with AHC and some others to look at what are the needs around housing, and we also have data on early childhood indicators. So we try to pull it all together about every 3 or 4 years so that we've got a snapshot of what's going on in Arlington. And then we want to engage with the community. So the data doesn't do any good sitting on our desk. We want to really make sure that the information gets out there to the wider community. And so we host meetings and we go out to PTAs and to civic associations and anybody who will be interested in hearing this information. And then through those meetings, we also ask for information back, like what stands out, what are some possible solutions or strategies that might work in the various communities around Arlington. And that leads us to our third word, which is advocate. So we do all of this because we are a community-led organization. We really can advocate to the school board and the county board to support what we're hearing from the community through our engagement. So those are our three words, and that is what we're doing. And today we're practicing a little bit of our community engagement through a presentation through online so that we can engage with people in different ways. So thank you for joining us.
All right, so before we jump into the data, just to kind of orient you to the 2019 Community Report. In the front of the report, there is essentially a summary or an overview of findings that we have pulled together, and we divided it up into kind of these three main headers. So we look at striking disparities, which is just the way of kind of breaking down some of the data, some of the averages to look at some demographic information and see if there's any subpopulations that are showing signs of greater need. There's the social determinants of thriving, so that's really looking at what resources or supports we could put in place that would really help, again, kind of address some of those areas of greater need. And then finally, emerging issues. So these are topics that we might not have any trend information about, so we don't know, what direction we're trending in, but we know that this information is showing us some troubling patterns, and we want to keep following those and monitoring them as we move forward.
So this slide is just to show you the various indicators that we are collecting data on. So we don't have a lot of time to go over all of these right now, but we want to make sure that everybody has the opportunity to see what are some of the very specific things that we're collecting data on. And also, this is a note of if you don't see something listed here that you would like to have listed and for us to think about more, please let us know. So this is a little bit about the data that we're collecting. But the first thing that we're going to talk about in a little bit more detail is childcare. So for children, for a family that has 2 kids, an infant and a 4-year-old wanting to attend childcare, in Virginia, the overall cost for that would be an average of $21,000. But it goes up, if you can see, in Fairfax and Alexandria and DC, with Arlington being $42,705. And that's very expensive for just about anybody. But we wanted to make sure that we point this out. So many families lack access to quality childcare, as spaces are only available for 51% of the county's children younger than age 5. So childcare puts a large financial burden on the families that even can access it, but 51% don't have access. So the reason why this is so important is that pre-K experiences, there's data to support how valuable they are for our children. So kids entering kindergarten in the fall, they go through some tests called PALS, and that's a test that looks at early literacy. And in this chart, you can see that the no formal, oops, that's the wrong tool to use, so I'm going to erase that, and I'm going to use the highlighter. So the no formal or unknown is down here, and that is the blue line. And so you can see that this is the blue line for Asian, Black, Hispanic, white, other, and economic disadvantaged students. Private providers are in that middle line, right there in the teal color. And then the Arlington Public Schools are in the yellow. So here you can see that our students who are African American, Hispanic, or economically disadvantaged are passing at a much lower rate than the students who have had some formal or APS provided pre-K experience. Am I getting that right? Does that make sense to everybody? So that's why it is so important for students to have some form of pre-K experience. The other thing around early childhood is childhood obesity. So kids enrolled in the preschool initiative program, which serves low-income students, were obese at a higher rate than the national average. So these are the Arlington averages, and the state average is 14%. So we're at 13% and 20% for overweight and obese. However, and this is one of those that we really want to also look at breaking out where we were talking about the disparities earlier. Within Arlington, the Hispanic youth reporting rates of obesity are much higher than other races. So this data is the high school youth in Arlington, and that's the Arlington is in the blue. Then the Virginia is in the orange color, and then Northern Virginia is in the yellow. So it's great, we're lower, but if you can see, the Hispanic students are still reporting much higher. And can you explain how we get that information from the YRBS?
Sure. So we do ask youth to self-report some of their information, demographics included. And for this one, we do ask them to say their height and weight. And then a calculation is done to then get their BMI, so then to calculate whether they are considered obese or overweight.
Okay. So now, food insecurity.
Sure. So youth in Arlington are certainly impacted by food insecurity. So some of the information that we put in the report include numbers that were given to us by APCYF, so we can look at how many people were served in Arlington at the Food Assistance Center. And then of those, about 35% were children. So that's pretty representative of what we're seeing below, which is that 1 in 3 APS students receive free and reduced meals. So that often kind of strikes people when they think about it. About 1 in 3, or a third of students qualify for free and reduced meals here. But there are certainly a lot of differences when you're looking across the county. So these are different elementary information, again, of the percentage of students at each elementary school who qualified for free and reduced lunches. And you'll see as it goes across the board here, The lowest school, only 1% of students qualified or received free and reduced meals, and then it just continues up, up, up. And then you'll see that the very highest of all the elementary school proportions was 81%. So that's a huge disparity, again, geographically speaking, because these are elementary schools, which can be a pretty good proxy in most cases for kind of geographical dispersion.
So affordable housing is a very big concern in Arlington, and there are a lot of different groups who are working on this. One of the reasons that it has been a problem is that you can see in this slide the number of market rate affordable housing units for those making 60% of the area's median income has dramatically declined over time, from about 19,000 in the year 2000 to just about 2,455 in 2017. So the Affordable Housing Master Plan has a goal of 17% of all housing units be considered affordable for families at or below 60% of the area's median income. As of 2017, which is the data that we had at publication, only 8.2% meet this criteria. So you can see the decline in the chart. This really makes a difference. And also of note, there is a 5-year wait list for affordable housing in Arlington right now. This chart demonstrates that affordable housing isn't just an issue for the lowest incomes. The purchase price that someone making the median income can afford is $450,000, and that's this line right here. So you can see the chart shows the difficulty that many families in Arlington face. There are very few housing options that would not require families to substantially stretch above their financial needs. So I'm just letting that sink in. That's why affordable housing is such a big issue in Arlington.
So the next set of slides look at some mental health measures that we collect, and just to kind of couch the conversation, one of our members, Dr. Alfie Breland-Noble, who works for Georgetown University but is also a national expert who speaks on this topic at great length, provided this quote for us, which is to say that depression is a universal illness that doesn't discriminate, but one that has racial disparities in terms of who gets care. So some of what we're going to present look at some of those racial disparities. So on that youth risk behavior survey, we do ask high school youth to report whether they've experienced these feelings of depression. So the question, I think, specifically asked, did you feel sad or hopeless for 2 or more weeks in the past 30 days? So this is a pretty good proxy for depression. And when you're looking at the breakdown by race and ethnicity, there are these really clear differences in terms of different racial and ethnic groups, whether they've experienced these depressive symptoms. This is even more stark when you then look at actual attempts of suicide. So the survey asks a variety of questions on this topic, including whether you've considered it, and then whether you've actually made an attempt. So this one is reporting actual attempts, and the difference is just very large. So with Hispanic youth reporting 11% compared to Black or white youth reporting those lower numbers. And then, as mentioned, there are just certainly differences in terms of who's getting help. So not only are there these youth of color who are reporting depressive symptoms at just a much higher rate. So again, the 37% for Hispanic versus 23% of white. But then there are differences here just in terms of who's actually reporting that they got the help they needed. So that's 37% of white students versus 23% of Hispanic students. And we don't have anything in the blue here to show for the Asian or Black students because the numbers were actually so low that I can't even report them out. And it's hard from a numbers perspective to tease out whether those numbers are so low, because they reflect actual experiences or folks just didn't feel comfortable reporting on a survey. But either way, they were just so low. So that speaks to whether they didn't want to talk about it. It could be a stigma issue or they truly are not getting the help that they need.
Either way, something
Either way,
to look at.
It's very important.
So at the beginning, we talked a little bit about emerging issues, and the next couple of slides are addressing some of those emerging issues. So sexual harassment. In the 2017 Youth Risk Behavior Survey, we found that nearly half of all female students in grades 8, 10, and 12 experienced sexual harassment on school property. We want to monitor this to ensure a safe environment and determine if there's a correlation between harassment and substance misuse or the effects of mental health. So this is one of those items that we're working very closely with schools and the community. One of the students that we work with, because we do try to talk to our students about this data on a regular basis, shared this quote. She says, "Nearly every girl I know has experienced some form of harassment or assault. The majority of them don't even define their experience with those words, seeing them as something nearly normal." So that's from one of our students who's a participant with the Healthy Relationships Task Force. And I'm thrilled to say that all of the high schools have them, and they are partnering with the Teen Network Board now, so that there is a large group of teens, boys and girls, who are addressing this peer-to-peer. And when they can share the message with each other, I believe there's real power in that. The other thing that comes up often is screen time. And as youth get older, they're reporting that they're on a screen more, with the average almost 10 hours per day for high school students. So the question that the survey asks seek to further understand the ways that youth are engaging with the technology and to ascertain if there are any correlations between time spent on screen and the time spent engaging in other activities, or looking also at the potential of the co-occurrence there with other risk factors such as depression. So again, it's difficult to find out what kids are doing online because so much of their learning is taking place online, which isn't a bad thing, but how can we make sure that they're getting good amount of balance so that they're doing the activities in the outdoor and the things that are really engaging in a different way than just online. So we're really struggling with how do we get at that, but we're continuing to work on that.
All right, so the last two data slides that we'll share look at substance use. And one emerging topic are e-vapor products. So again, this sometimes is referred to by different names, often e-cigarettes or Juul, which is one of the brand name products. But as you can see here, we surveyed both middle school and high school students, and then I just did a comparison to cigarette usage because cigarette smoking has been something that has continued to decline. But then all of a sudden came along these e-vapor products that just really shot up the number of students using them. So in middle school, we're seeing about 3% using e-vapor products and about 13% using e-vapor in high school. And some of what we've cited in the report, but I know the research is constantly evolving on this topic, but one thing that's been noted in research is that students who use e-vapor products in middle school are then actually more likely to start smoking in high school. And that, again, the nicotine found in these products are priming the same kind of reward centers of the brain that a cigarette would have been doing, or other substances that they're starting at these early ages. So it's kind of setting them up for future potential negative outcomes. And then the next slide just looks at Virginia substance use versus Arlington substance use. So on the left in blue here are the Arlington numbers, and then on the right in the yellow are the Virginia numbers. And this is something we get asked a lot about, is just sort of how does Arlington compare? So this shows that across most of these categories of substances, we're pretty similar to the state usage rates. They're usually within a couple percentage points. The one that really jumped out to me as kind of being alarming was that in Arlington, about 19% of students said that they had been offered or sold drugs on school property. And this is in comparison to 16% of them in the state as a whole. So just something that we're certainly, again, kind of monitoring and being aware of.
So that's what we wanted to share with you. When we are in person, then we really find a lot of value in the conversation, in small tables or in groups. And we really want folks to think about what stands out, what are some contributing factors, and what are some potential strategies that might work in your community where you are. So if you have some time and you want to share with us what stands out, what are some contributing factors, and what are some potential strategies, you can send the responses to our email at apcyf@arlingtonva.us, or feel free to share on Facebook. We're at APCYF on Facebook, and we'd love to have you join us. So thank you so much for listening. If you've stuck with us this long, this was a fun experiment. This is how you can find out about us. We're always interested in having people join us. We meet on the fourth Wednesdays at 6 o'clock to 8 o'clock in the Sequoia Plaza, which the address is on this slide here. And just reach out and get in touch with us. Rebecca and I don't mind coming out to where you are, and we'll meet with 2 to 200 people. I don't know, if you had more than 200 people, we'd be thrilled, but we're happy to meet with whoever wants to talk about this data. So thank you very much, and have a great afternoon.